offer you is using lasers to not replace the skills of a surgeon, but to possibly enhance and create more time for you. What I briefly want to do, because lasers may or may not be a new concept to you, I just want to briefly talk about how these low-level lasers work. Then I want to look at the method we use, and then I'm going to present some research that we have done on this, and then I'm going to give you my conclusions in hopes that you can draw your own. Basically, low-level laser runs in the visible light spectrum, and the laser that I actually used for this research was a 635 nanometer laser. But we know, because of the method of action of laser and the way that photodynamics work, that the effect of a green laser is going to be the same. The main difference being that green lasers have a stronger affinity to collagen reprocessing and also to elasticity within the tissue. So basically what I'm going to talk to you about is 635 nanometers, which is a red laser. And what basically happens is, if you think of the laser as a delivery system for photonic energy, in a similar way to if I have a patient who I'm going to do some surgery on, I'm going to draw up a local anesthetic, perhaps in a syringe, I'm going to attach a needle to that, and I'm going to inject that into the patient. So the needle becomes the delivery system for the local anesthetic that I'm going to use. In a similar way, the laser is a delivery system for photonic energy, which I'm going to use to target the cell. And the way that this works is similar in all lasers, especially cold lasers. And the photonic energy targets the mitochondria within the cell. And when it reaches the mitochondria, what it basically does is it is absorbed by cytochrome C. And as cytochrome C absorbs this, it breaks down in the available fluid. And as it breaks down, it basically attracts adenosine biphosphate. It picks up a phosphate molecule and it becomes adenosine triphosphate. This drives the electron transport chain. I think you know the rest of the story there. We studied it enough in medicine. But part of this process is upregulation of certain genes, especially in the interleukin area. And we all know that what happens when we're talking about genes, when we look at interleukin 6, it's one of the things that causes us most problems. It's causing problems with inflammation, it's causing us to age, it's causing us to build fat, it's causing us to do a lot of things. So by upregulation, we can actually modify what that's doing. The end point of this cascade is basically, as you can see here, it causes the fat to emulsify within the fat cell. So as that fat emulsifies, it expands, and it comes out of the cell through a single transitory pore into the lymphatic system. Now when it's there, because our lymphatic system has no pump, by action of movement, we actually burn off some of that free fatty acid. More of it is going to be absorbed by the lymph vessels and excreted that way, and another proportion of it is actually going to be restored. So basically you can see the sequence of events. So this is an open cell. We've targeted with the laser, and basically here we have where it has shrunken right down. When we look at lasers for this, we can look at lasers which generate heat, or we can look at lasers that don't. In my clinic, we're looking for something that's efficient. We're looking for something that basically gives us the training that we need and allows me to use my technical staff so that if I have to do surgery elsewhere, my technical staff can do that. So we went with the Erchonia laser, which we have outside, basically because of the support and the FDA clearances and the research behind that. My special interest is really in diabetes with these devices. So I'm not going to tell you about diabetes. We all know about that. We only have limited time. So basically I'm going to push on to the study. But first of all, I'm going to reiterate this new classifications that we're using in diabetes. We're not using type 1, type 2 and gestational diabetes anymore. We're talking about diabetes classified this new way. An interesting statistic as well is it's estimated that the world population for diabetes is going to hit 490 million worldwide. This was in 2011. This is since 2011. So if you look at the figures there, this is becoming a growing problem. How do we prevent diabetes? Can we prevent diabetes, I think is more the question that I should ask. In my view, we can look at healthy diet, we can look at regular exercise, we can also look at maintaining our body weight, but we also have to look at our lifestyle. And sometimes when we gain weight, it's not just to do with diabetes and food, it's also due to psychological and psychosocial factors. And a lot of patients with diabetes will at some stage end up needing some procedure to rectify that, either from me as a podiatric surgeon or from you as a bariatric specialist. So in the study that we did, we took 140 patients. All of the patients were pre-diabetic and all of them had increased blood sugars over 3 consecutive tests over 3 weeks. The BMI that we were working with was from 30 to 41. The reason I picked 41 is we kind of think a lot of the time that 40 is the tipping point. But because of mitochondrial action, I would like to think that we can actually take this a little bit further. So what we did, as most researchers would do, is we put 70 patients into one group, 70 into another. We gave laser to one group and not to the other. But all groups basically saw our nutritional specialist and had nutritional management. And as well as that, they all had an exercise program. We subjected them to 20 treatments over 10 weeks. And a treatment basically lasts for 40 minutes on 2 20-minute cycles. We had a 5-minute rest period in between. All of the patients on this program, whether they had placebo or active laser, received the same mild ketogenic diet. So not an extreme diet, a mild ketogenic diet. And they all basically took part in exercise with one of our physical exercise specialists. So diabetes is a growing problem across all peoples and all ages, and basically we need to find a way of improving life outcomes and, if possible, changing our lifestyle so that we don't develop as much diabetes. So what we've done is I've broken down results of both groups. So when you look at this, you can see the before and after of the active group. So we went from 40 down to 32 and from 41 down to 39 in terms of BMI in the both groups over the 18 months. When we look at statistics, there you have the statistics. And then when we look at weight loss between the two groups, the active group over the period, you can see the amount of weight loss here. The control group, because they were on the same diet, because they had the same exercise, we expected to see weight loss. We didn't expect to see such a good result as a response to the laser. When you put the two side by side in the third column, you can actually see the difference between the diet alone and the application of the laser. So when we look at pre and post risk, 140 patients, on the active scale, you can see the difference there. We had one patient in the active scale that went on to develop diabetes, whereas on the control group, we had 6 that didn't. So with laser and diet at the end of 10 weeks and over the course of the study, you can see there 1 with, 6 without. Our follow-up was at 18 months, so again, our risk factor was always going to be 140. On the active side, one of our patients went on to develop diabetes. And when you look at the interesting part for me, the mortality, we lost 2 patients from the placebo group due to comorbidities associated with diabetes. So weight loss between the 2 groups when we push it out to the 18 months, basically what you're looking at here is the active group at the beginning, we're looking at them at the end, and we're looking at the end of the active laser. So they still continue to go on to lose weight. And when we put both groups side by side, again, you can see the vast difference that's there. So diabetes is going to continue to be a problem. We need to educate. We need to look at ways of managing it. And diabetes isn't just about diet, because the amount of processed food we eat sometimes it's a case of we need not just to tackle our own attitude to food, we need to tackle the attitude of our food producers in terms of what they allow us to eat and the way that food is advertised. So we have to look at the psychosocial, and we also have to look at the psychological problems associated with it. So laser, as a result of this study, in my opinion, is a viable option for the treatment of pre-diabetic and obesity management. It produces or may produce a new role for clinicians when it comes to using technologies like this, should it go forward. These are my references. I'm happy